Hello, and welcome to this presentation on fall risk prevention. Patient falls are a major concern within hospitals and healthcare facilities. According to Morris and Oridian 2017, falls among inpatients are the most highly reported safety incident in hospitals, with around 30 to 50% of falls resulting in some type of physical injury. Older adults account for most accidental falls within the medical setting, which dramatically increases hospital stays and mortality rates. It also increases costs of the hospital system who care for these individuals. According to Florence et al. 2018, in 2015, the estimated medical costs attributable to fatal and non-fatal falls was approximately $50 billion in older adult populations within the United States. Falls are a preventable occurrence and should have increased awareness around them. Since nurses care for patients the most during hospitalization, they should be the ones to work to improve the fall rates within their facilities. So, the question for this clinical problem is, how do we prevent patients from falling in the hospital? There's plenty of evidence to support how to prevent falls in the hospital setting, yet it continues to happen frequently. First, we must look at some of the risk factors that contribute to falls. According to Morris and Oridian, 2017, risk factors include advanced age of greater than 85 years old, male gender, a recent fall, agitation or confusion, new urinary incontinence or frequency, adverse drug reactions, and neurovascular instabilities. Second, we must consider the use of evidence of what has been successful in the past, what continues to be used in practice, and what seems to be the most effective methods of preventing falls to date. According to Morris and Oridian, 2017, single interventions such as high-risk wristbands, bed signage, and medication review are generally not successful in reducing falls or fall rates. Instead, more promising results have been seen when the complex multiple components of risks are accounted for in an assessment and management through relevant interventions, although the combination is still not clearly defined. The best practices for fall prevention tend to include empowering multidisciplinary teams to test and refine interventions that focus on the main causes of inpatient falls. Based on this information, the focus of this presentation was built around a multifocal approach to fall risk prevention. I will begin by sharing a PICO format that helps define the proposal of this clinical problem. P, the population will be newly admitted patients to the hospital. I, the intervention is having the patient wear a fall risk bracelet and always having assistance by the nursing staff when ambulating after screening positive to a fall risk questionnaire. C, the comparison intervention is not having positive screened patients wear a bracelet or using assistance while ambulating, which will be the control group. And O, the outcome should be that fall risk patients with fall risk bracelets and assistance in ambulating should experience less falls than those without fall risk bracelets and ambulatory assistance. My intention is to implement a fall risk prevention program for this unit. This will be done using a pilot study to gain useful information from both staff and patients in response to managing fall risk. The basis of the study is to increase awareness surrounding potential fall risk hazards before they actually take place. We will conduct this prevention program through a screening tool upon patient check-in, which asks the patients necessary questions specific to increased likelihood of falling. The questions will be straightforward and easy to understand. Specifically, the questions will ask, 1, has the patient fallen within the last year, or do they have a fear of currently falling? 2, does the patient use an assistive device to walk? 3, today, does the patient feel shaky, unsteady, or dizzy? And 4, has the patient taken any medications within the last 6 hours that may make them feel drowsy or dizzy? If the patient screens positive to one of these questions, we must ask them to wear a fall risk bracelet and have assistance at all times when ambulating. The staff will also take a survey at the end of each week during the study to provide useful feedback on how they feel the fall risk prevention program is going. This study will take place over 3 weeks, and results will provide us with evidence of implementing the process into practice. The theoretical model that will be used to construct this study are practice theories, which are a type of middle range theory and will help incorporate implementation of the fall risk prevention program. According to Grove and Gray 2019, practice theories are designed to propose a specific approach to particular nursing practice situations, in this case, fall risk prevention. In order to make the study as clear as possible and avoid barriers, the staff must all be willing to participate in their roles according to the study guidelines over the next 3 weeks. This study is fully supported by our leadership team, and we encourage everyone to ask questions and share their perspectives and thoughts pertaining to the study before it begins. This study will not include financial support or incentives, but rather will collect data directly for the unit and eventually the hospital to be used based on your dedication. We understand that this may be more work or take time and attention. However, it is for the benefit of the patient to keep them safe during their care at our hospital. The goal of this process will be to provide our patients with the best care possible and decrease the event of unnecessary falls. In order to help support this process, we must collect internal evidence to help gather data. The specific data we will be gathering during this 3-week pilot study will be survey-based, collected from staff participating in the study. The survey will consist of 10 questions, with 5 being short answer and 5 being rate on a scale of 1 to 5 based on satisfaction, with 5 being very satisfied and 1 being very unsatisfied. The feedback we will generate from your surveys will be compiled over time and will be discussed after the pilot study is complete. We encourage you to be expressively honest with your experience over the 3 weeks and would like you to include all subjective and objective data that you observe and gather from your patients. Please provide evidence specifically of fall risk related to the control group versus the experimental group. We would also like you to provide positive insights with the study and negative insights or improvements that you may come across. This information will help with the implementation process of the best fall risk prevention we can provide to our patients. I would like to mention that further research may need to be conducted before fully implementing this into practice so we can ensure the safety of our patients and staff and increase outcomes at the same time. At the conclusion of our pilot study, we would also like to ask each nursing staff participant how they may envision the fall prevention process progressing in the future of care. There are several ethical considerations to discuss before we begin this pilot study. I would like to mention that patients may not always be pleased to hear that they screen positive as a fall risk if they feel they are not at risk of falling. However, the fall risk questionnaire was designed to promote early recognition of patients who may experience falls during hospitalization, even if the client is unaware. This may affect patient dignity and autonomy in the sense of right to self-determination. Patients will have the right to refuse answering these questions if they choose. However, we must ask the questions with all patients. We must also thoroughly explain what the process is by letting the patients know before asking the questions that we are rolling out a fall risk prevention program, so they are aware of the process of the questions in order to not keep information from them. If they do screen positive, nursing staff must explain the reason they screen positive, so no information is withheld from the patients. We anticipate that not every patient will appreciate this process, but we will do our best to make it as fluid as possible. Other ethical considerations are the increased workload that nurses will experience during this pilot study. This is a nursing-aimed study based on the implementation of fall risk prevention interventions. Eventually, this will include a multidisciplinary staff, but for now, the focus is exclusively on nurses. We encourage nurses to discuss any strain they feel from this study. Fall risks are a major hazard to patients and clearly affect the hospital. We must find an adequate solution to manage this clinical problem so that we can decrease the numbers of affected human lives that may suffer annually from hospital falls. One of the purposes of this study is to find a gold standard that may work for hospitals throughout the country. We are looking at the big picture of health outcomes and how to improve overall healthcare in terms of inpatient fall prevention. Thank you for being a part of this step towards the well-being of our patients. We know that you will contribute to finding the answer for this overwhelming clinical problem.